This video will cover hereditary elliptocytosis, which is a cytoskeletal disorder of red blood cells. Kings are dominant, aren't they? This king represents the autosomal dominant inheritance of this disease. Do you notice his belt buckle? It says greater than 25%, which represents that more than 25% of circulating red blood cells should be elliptocytes when considering this disease. The iron dumbbell on the ground represents iron deficiency, which can cause red blood cells to become elliptocytes and must not be confused with hereditary elliptocytosis. Perhaps this king has been watching too much TikTok, and he's on one of those fad carnivore diets, because why else would he have a whole liver there? Fortunately for us, it's a good way to remember that vitamin B12 deficiency can also commonly cause red blood cells to become elliptocytes. Moving on to the bones next to the liver. These will help us remember that myelophysis, which is when normal marrow is replaced by non-hematopoietic cells or abnormal cells. This is yet another condition that can lead to red blood cells deforming into elliptocytes. The scepter the king is holding represents a defect in alpha spectrin, which sounds like scepter, and is the underlying cause of the disease. It's obvious the king has been working out. His physique here is a reminder that a defect in protein 4.1 can also lead to this disease. Lastly, let's talk about what he's drinking. Glycine sounds a lot like a certain delicacy drink from childhood days that we're all familiar with. It will help us remember that defects in the glycophorin C protein can also lead to this disease.